Today we're delving deep into the stark contrast between urban and wilderness emergency response times and the unique challenges of providing first aid in remote environments. Now, whether you're a day hiker or a seasoned backcountry explorer, understanding these differences is vital for your safety and that of the others in your group. Let's embark on this journey of learning and preparedness. In urban areas, the proximity to hospitals and the availability of emergency services significantly reduce response times. The average ambulance response time in cities can be as low as 8 to 15 minutes. Urban areas have many medical facilities equipped with advanced technologies and specialists. In contrast, the wilderness environment introduces significant delays. In remote areas, it can take hours or days for help to arrive. Factors like inaccessible terrain, distance from medical facilities, and lack of cell phone service contribute to these delays. Often, you're the first and only responder. Your knowledge and the contents of your first aid kit are your primary tools. So, let's analyze a common scenario. You plan a short 4-hour hike. You and your friends expect to be back at the trailhead by dinner. Near the halfway point of the hike, a member of your group twists an ankle and cannot walk. Nightfall is approaching. What do? Let's break this down. You perform a primary and a secondary assessment. You evaluate the injury. Is it a sprain, a fracture, or something else? Your first aid response sets the tone for what follows. You'll have to manage your limited supplies. You expected to be out only a few hours. Did you bring enough food and water for an overnight stay? Did you bring a lighter to start a fire? Did you prepare the people in your group to carry extra items just in case? And hypothermia is a real threat. Did you bring a jacket, emergency blankets, and some extra clothing to keep warm and provide protection from the elements? Do you have a communications plan in case you don't have a cell phone signal? Did you bring a personal ELT, a whistle, or a mirror for signaling? In the wilderness, unlike the urban environment, you may need to care for an injured person for an extended period. You'll be required to make regular checks for vital signs, changes in condition, managing pain, and keeping the patient comfortable. You'll be responsible for the patient's hydration and nutrition. And these are critical items, especially if the wait for rescue is long. You may be required to find water and purify. No, by the way, did you bring items in your kit to purify water? And then you'll have to decide whether to evacuate or wait for rescue. Weigh the risk of moving an injured person against the potential wait for rescue. Consider the difficulty of the terrain and the distance to the nearest trailhead or accessible location. Now, the workflow diagrams in Wilderness First Aid Made Easy include evacuation guidelines to assist you in your decision making. If evacuation is the only option, then you'll need to consider how you will evacuate a patient who is unable to walk. Your WUFA education should include how to create a litter using branches, clothing, or backpacks. Learn how to and practice how to carry an injured person safely, considering their condition in the terrain. And you'll learn more about moving patients later in the course. Pre-trip planning and proper preparation can prevent many emergencies. Include obtaining a detailed weather report of the area you're operating in. Understand the environment you're entering. Know the common hazards and how to avoid them. And always let someone know your plans and expected return time. Pack your kit for the unexpected. Carry extra food, water, and appropriate gear for an unplanned overnight stay. If you're with a group, then you can spread these extra items between the members of the group to lighten your load. I'm often asked to comment on the most important item you can carry in your first aid kit. And that item is your first aid training and the knowledge on how to use the items in your kit. Your skills and knowledge are your best tools. Recertify your WUFA training every 2 years. Use the workflow diagrams in Wilderness First Aid Made Easy to review and refresh your knowledge. Visit, like, and subscribe to the School of First Aid's YouTube channel for extra resources to grow your knowledge and your skills. In the wilderness, time is a critical factor that can mean the difference between a manageable situation and a crisis. Be prepared, understanding the potential delays in emergency response, and know how to manage your resources effectively can be life-saving. Remember, the wilderness is not a respecter of persons. It is unforgiving. It demands our respect. And with the right knowledge and preparation, it can be safely enjoyed.